Have you ever stopped to think about pregnancy? I mean, really think about the sheer complexity, especially in, a big animal like a horse. It's just incredible. But what happens when that whole delicate system gets disrupted? When something vital, something meant to nurture life, actually becomes inflamed? Today, we're diving deep into equine placentitis. If you're involved with horses, particularly breeding, this is, well, it's essential information. We're talking about the single biggest reason for late-term abortions, stillbirths, and premature foals in mares. So our mission today is to really unpack it. What is placentitis? Why is it such a huge concern? And importantly, how do we spot it and treat it? This has massive economic impact, of course, but also huge welfare implications. So yeah, a really critical topic.
It really is. And something people often miss is that the placenta, it isn't just passive tissue from the mare. It's actually the foal's organ. It's the absolute lifeline. It handles everything, nutrients, oxygen exchange, getting rid of waste. So you can imagine if that organ gets inflamed, its function is seriously compromised. And that directly impacts the foal's health, its very viability. Understanding that is, I think, key to grasping why placentitis is so serious.
Okay, yeah, that paints a very clear picture. So let's start right at the beginning. Placentitis, what exactly are we talking about?
Well, at its most basic, it's just what it sounds like, inflammation of the placenta. It happens in the mare's reproductive system, and we typically see it pop up in late pregnancy, though it can happen earlier. The core issue is usually an infectious agent getting in. Could be bacteria, could be a virus, sometimes even a fungus. And that invasion triggers this big inflammatory response. The fallout from that, well, you can get placental detachment, parts of it separating. It might get thick, either just in spots or all over. And it can make the uterus irritable, potentially kicking off early labor.
Okay, so if it's usually an infection, how do these things, bacteria, viruses, how do they actually get into what seems like a really protected space? What are the pathways?
Good question. By far, the most common route is what we call ascending infection. Basically, bacteria travel up. They come from the mare's vagina, manage to get through the cervix, and then into the uterus where they hit the placental membranes. And when that happens, the infection usually starts right at the cervical star. That's the part of the placenta sitting right next to the cervix. Think of it as the front door,
The
almost.
main entry point.
Makes sense.
Exactly. Less often, maybe, you get hematogenous spread. That just means the infection travels through the mare's bloodstream.
Mm.
So if the mare has some kind of systemic illness, the bug or maybe toxins can reach the placenta that way. There are other possibilities too, like direct inoculation during a vet procedure or maybe an old infection flaring up, but they're less common than that ascending route.
So you mentioned bacteria are the most common culprits. Who are the usual suspects there? And do they all cause the same kind of trouble once they're in? No, they definitely don't all behave the same way, and that's really important for diagnosis and treatment. Bacterial placentitis can pop up anytime during pregnancy, really. Sometimes you see an acute form, sudden, maybe localized inflammation, maybe widespread. Often that's earlier on, say mid-gestation. Other times it's more chronic, develops slowly. And that often centers around that cervical star area we just talked about. That chronic type has a different inflammatory picture, usually seen later in pregnancy. As for who they are, common names you'll hear are Streptococcus, Equisubspecies Zooepidemicus, Klebsiella, E. coli, Pseudomonas. Those are the frequent flyers, let's say.
Right, so different bacteria, different presentations.
Exactly. And recognizing those patterns helps vets figure out what's going on and how best to treat it. Makes catching it early even more vital.
Okay, that clarifies the common bacterial stuff. But I've heard of something called nocardioform placentitis. That sounds different, almost exotic.
It is different. Yeah, no cardioform is its own distinct thing. It's caused by specific bacteria, these branching filamentous types, often found just out in the environment. We're actually not 100% sure how they get in. It's probably not that typical ascending route. What makes it stand out is the lesion itself. It's usually pretty localized, thick, kind of mucoid, slimy, and often this tan color. And here's the kicker. Unlike the ascending type starting near the cervix, no cardioform lesions usually show up deeper inside, at the junction between the uterine body and one of the uterine horns, like way up in there.
So harder to spot, maybe.
Much harder to diagnose beforehand. Mares with this type often don't show those classic warning signs like bagging up early or having discharge. That makes antemortem diagnosis before foaling a real challenge. Oh, and just going back to that hematogenous spread the bloodstream route, one specific bacterium to mention there is Leptospira. When that gets in via the blood, it can cause this diffuse, sort of widespread infection across the placenta, often gives it a very characteristic lumpy, cystic look on the surface.
Wow, it really is like detective work, isn't it? The location and look giving clues. What about viruses and fungi? We hear so much about equine herpes virus, EHV1, causing abortions. Is that placentitis?
That's a great point. Viruses can definitely cause placentitis, although maybe less frequently than bacteria overall. Equine viral arteritis, for instance, can lead to a general thickening of the placenta. Now, EHV1, yes, it's a major cause of viral abortion, but it's often tricky. The mare herself might seem perfectly fine, no obvious signs of being sick, and the placenta. Sometimes there are lesions, sometimes they're quite minimal or nonspecific, so it doesn't always present like a classic inflamed placenta you see with some bacteria.
Interesting difference.
And fungi. They tend to show up later in the game, usually 300 days of gestation or more. You might see things like aspergillus. That can cause a chronic, localized inflammation near the cervical star, actually looking a bit like some chronic bacterial cases. Candida can be more diffuse, more destructive. Histoplasma tends to cause these little scattered inflammatory spots, granulomas.
So it's not just about the bugs themselves. Are there things about the mare herself, her anatomy, or even the environment that can make her more susceptible, put her at higher risk?
Absolutely. Anatomy plays a big role. Things like cervical incompetence. If the mare's cervix doesn't seal properly, maybe from an old foaling injury or just changes with age, it's like leaving the door unlocked for bacteria.
Okay.
And maybe even more common is poor vulvar conformation. You see this often in older mares or mares that are a bit underweight. Their vulva might slope downwards. This slope can literally cause them to suck air and fecal material into the vagina. We call it a pneumovagina.
Right, I've heard of that.
Yeah, it basically creates this contaminated environment, perfect for bacteria to then travel up towards the cervix and uterus. And beyond the big structural things, just general poor hygiene or having the wrong kinds of microbes hanging around that break down the natural protective barriers, those are risk factors too.
And what about that MRLS thing you hear about sometimes? Mare reproductive loss syndrome? Didn't that involve caterpillars?
Yes, MRLS. That was a devastating outbreak, particularly in Kentucky years ago. The link was strongly suspected to be eastern tent caterpillars. The theory, and it's pretty well supported, is that the tiny hairs on these caterpillars, the setae, when ingested by the mares, cause irritation and inflammation in their gut. This gut inflammation could then allow bacteria to leak out, get into the bloodstream, and travel to the placenta. It's a really striking, kind of scary example of how something environmental can trigger placentitis systemically.
Wow. Okay, so given all these different causes, these different ways it can look, how do you even spot this? What are the clues? Because it sounds like it could be easy to miss, especially early on.
You're absolutely right. The signs can be subtle. They can be inconsistent. That's what makes early detection so challenging for owners and vets. But there is one sign that's probably most common and often the earliest thing you might notice. That's premature udder development or bagging up too early. So a mare might start developing a full udder, maybe even dripping milk, weeks, sometimes months before she's actually due.
Oh, wow.
Yeah. Compare that to a normal mare who typically only starts bagging up properly about 2 to 4 weeks before foaling. So seeing that udder develop way ahead of schedule is a major red flag. It tells you her body is starting the foaling process way too soon.
Okay, so premature bagging up, that's a big one. Anything else to watch for?
Well, you might see vulvar discharge, but it varies hugely. Could be thin and watery, could be thick mucus, could be actual pus. Color can range from white, yellow to brownish, and it might be there constantly or just on and off. Sometimes owners just notice the mare's tail hairs are matted, which is a clue. But, and this is important, discharge isn't always there. You can definitely have placentitis without obvious discharge. Ultimately, if it's severe or if it goes untreated, the end result is often, unfortunately, abortion. Or the foal is born prematurely or it's born compromised in some way. This usually happens late in pregnancy, that third trimester. And those foals, they might be small, weak, underdeveloped for their gestational age. We call that dysmature. They could be septic, meaning they have a body-wide infection. They could be stillborn. Or they might even be dummy foals, suffering from brain damage due to lack of oxygen in the womb. Less commonly, the mare herself might show signs like a fever or just being lethargic, but those aren't usually the first things you see.
Okay, so let's say there's a suspicion. Maybe the mare bagged up early or there's some discharge. What tools do vets use to actually diagnose this, to confirm it and figure out what's going on?
Right, the diagnostic toolbox. The number one tool we rely on before the foal is born, the main antemortem tool, is transrectal ultrasound. Specifically, we measure something called the combined thickness of the uteroplacental unit, or CTUP. We measure this right where the cervix meets the placenta. And the key is comparing that measurement to what's normal for that specific stage of pregnancy. If the CTUP is significantly thicker than expected, well, that strongly suggests placental thickening, inflammation placentitis.
So there are standard thicknesses vets look for at different times.
Exactly. There are established normal ranges. For example, roughly speaking, it might be around 4 millimeters between months 4 and 9. Then it increases a bit each month towards the end. But critically, it shouldn't exceed certain thresholds, like maybe 8 millimeters between days 271 and 300, or 10 millimeters between 301 and 330, numbers like that. An abnormal increase is the red flag. And this CTUP measurement is particularly good for picking up that common ascending placentitis starting near the cervix. The limitation, though, goes back to that no cardioform type. Because those lesions are higher up near the uterine horns, they can be missed just looking at the CTUP near the cervix.
Okay, so ultrasound is key. Are there other imaging methods or ways to look directly?
Yeah, we don't stop there. Transabdominal ultrasound scanning across the belly can also be really useful. It lets us see other parts of the placenta, check for abnormal fluid in the uterus. Sometimes you see this sort of swirling hyperechoic fluid, which isn't normal. And crucially, it lets us check on the foal itself. We look at its heart rate, its movement, get a sense of its well-being. Then there's the vaginal speculum exam. This lets the vet directly look at the cervix. Is it closed properly? Is there discharge coming through it? Does it look inflamed? But there's big caution here. Vets have to be really gentle. Too much poking around could potentially trigger uterine contractions or even introduce more bacteria.
Right, delicate balance.
Very delicate. If there is discharge, a special sterile swab, a double-guarded one, can be used very carefully to collect a sample for culture without contaminating it. Beyond the imaging, hormone levels can give us clues too. We can monitor progestogen levels in the mare's blood. Normally, these are pretty stable during the relevant part of pregnancy, so big fluctuations, either high or low, can signal that the fetus is stressed or something's wrong.
And estrogens too.
Yes, certain estrogen levels, like estrone sulfate, can drop if the fetus is stressed, or worse, if it dies, because those estrogens are actually produced by the combined fetal placental unit. And then there are markers for inflammation in the mare herself. Serum amyloid A, or SAA, is becoming a really useful one. It's a protein that shoots up quickly in the blood when there's inflammation anywhere in the body. So a high SAA suggests inflammation is present, and it drops quickly when the inflammation resolves, so it's also great for monitoring if the treatment is working.
That sounds really helpful for tracking progress.
It is. And finally, of course, there's culture and sensitivity. Ideally from that carefully collected cervical swab, or sometimes vulvar swabs. This tells us which bacteria might be involved and which antibiotics are likely to kill them, but the absolute definitive diagnosis often comes after an abortion or foaling by culturing the placenta itself and fetal tissues like stomach contents, lung, liver. That gives the clearest picture.
Okay, so once placentitis is diagnosed, what's the plan? How do you actually fight this? You said it needs an aggressive approach.
Absolutely. Aggressive, multimodal, meaning using several different types of treatment, and often it has to be prolonged. The goals are pretty clear. Number 1, control the infection. Number 2, reduce the inflammation. Number 3, keep the pregnancy going as long as safely possible. And number 4, do everything we can to maximize the foal's chance of being born healthy. So the cornerstone is antimicrobial therapy, antibiotics. We usually start immediately with broad-spectrum antibiotics, ones that cover a wide range of bacteria. And critically, they need to be able to get across the placenta to reach the infection and the foal.
Are there specific ones that are better at that?
Yeah, some are known to penetrate the placenta better than others. A common choice is trimethoprim sulfamethoxazole TMS, for short, partly for that reason. Penicillin and gentamicin used together is another combination, or sometimes ceftiofur. And this isn't just a week-long course. Often the mare stays on antibiotics for the rest of her pregnancy. Or sometimes vets use a pulse therapy, maybe say 10 days on antibiotics, 10 days off, then back on again. Long-term is usually needed.
Okay, antibiotics tackle the infection. What about the inflammation itself? That seemed like a really big part of the damage.
Huge part. So anti-inflammatory medications are vital. NSAIDs, non-steroidal anti-inflammatories like flunixin, meglumin, or maybe ferrocoxib are used to bring down inflammation and help with any pain. Aspirin is sometimes used too. It's anti-inflammatory, and it can cross the placenta, which might offer some benefit to the foal directly. And another important drug often added is pentoxifylline.
Pentoxifylline, what does that do?
It's interesting. It has anti-inflammatory effects, but it also affects blood flow. It's what we call hemorrhagiological. It basically makes blood less viscous, helps it flow better. The idea is this could improve blood supply to the compromised placenta. There's even some research in other models, like mice, showing it can be beneficial in situations involving endotoxins, which can be released by bacteria.
Interesting. Okay, so antibiotics, anti-inflammatories.
Right.
What about hormonal support to keep the pregnancy going?
Yes, that's often the third pillar. Hormonal support, typically using a synthetic progestin called altrinagist. The common brand name is Regumate. It's given orally, usually daily. Its main job is to promote uterine quiescence. Basically, keep the uterus calm, stop it from contracting, and reduce the risk of premature labor and delivery. It might also have some local immune benefits in the uterus.
So it helps maintain the pregnancy.
It does, but there's a really crucial but here. If, despite treatment, the fetus dies in utero, you must stop the altrenagest immediately,
Why is that?
because you need to allow the mare's body to expel the fetus. Continuing the progestin could prevent that, leading to the fetus decomposing inside the mare, which is incredibly dangerous for her. You'd continue the antibiotics and anti-inflammatories for the mare's sake, of course, and watch her very closely for complications like laminitis, which can sometimes follow these situations.
Got it. Critical point. So beyond the meds, what about just general management or even surgery?
Good question. Supportive care definitely matters. Strict hygiene is important, a clean, dry stall. Minimizing stress for the mare as much as possible. And if that poor vulvar conformation, the pneumovagina, is identified as a contributing factor, then yes, surgery might be part of the plan. A Caslix operation is a simple procedure where the vet sutures the upper part of the mare's vulvar lips together. It creates a physical barrier, sealing off the vagina from contamination.
Ah, so it stops bacteria from getting in that way.
Exactly. And this is vital. You absolutely must remember to have the caslix opened before the mare is due to foal. Otherwise, she won't be able to deliver the foal.
Right, okay. Good reminder. So throughout all this treatment, monitoring must be intense.
Absolutely relentless. Vigilant monitoring is key. For the mare, that usually means regular transrectal ultrasounds, maybe weekly, to track that CTUT measurement, see if the placenta is responding, thickening less, or stabilizing. Plus, watching her clinical signs, udder, discharge, her overall health. For the foal, it's transabdominal ultrasound checking heart rate, watching it move, assessing its well-being as best we can from the outside. And then, if the mare does carry the pregnancy towards term, you absolutely have to attend the foaling.
Why is that so critical?
Because there's a much higher risk of things going wrong during birth. You might get premature placental separation, the red bag delivery, where the placenta detaches too soon, or if the placenta is really thickened from the inflammation, it might fail to rupture normally at birth. The foal can get trapped inside, unable to breathe. That's neonatal asphyxiation. After the foal is born, you need to check the placenta carefully to make sure it all came out, retained membranes are a risk. And you watch the mare for that premature lactation we talked about. If she leaked a lot of milk before foaling, her colostrum, that vital first milk packed with antibodies, might be depleted. That can lead to failure on passive transfer in the foal, meaning the soul doesn't get enough antibodies, leaving it really vulnerable to infections.
And the foal itself, even if it survives, might need extra care.
Definitely. You have to be prepared for a foal that might be septic, might have neurological problems, might be undersized due to growth retardation in the womb. Intensive neonatal care might be required.
Okay, so after going through all of that, diagnosis, treatment, monitoring, what's the actual outlook? What's the prognosis for a mare diagnosed with placentitis? And can we do anything to prevent it in the first place?
The prognosis. Well, it's generally described as guarded to fair. It really depends. The factors that improve the odds are definitely early diagnosis and aggressive treatment. Catching it before there's severe placental damage or the foal is already badly compromised makes a huge difference. Ascending placentitis, if caught early, often responds reasonably well to treatment. Seeing a positive response like the CTUP decreasing or stabilizing, the clinical signs resolving, that's obviously a good sign too.
And what makes the prognosis worse?
Things like a late diagnosis, already having severe placental separation or thickening, evidence that the foal is already septic or significantly distressed, those definitely worsen the outlook. If the infection doesn't respond to the antibiotics, that's bad news too. Or if the mare develops serious complications herself, like laminitis. And even if the mare carries the foal to term, you have to remember that foal might still be premature, dismature, septic, potentially needing a lot of intensive care to survive and thrive.
Does it affect her future breeding potential?
Often, surprisingly no, mares frequently remain fertile for future pregnancies, especially if a specific cause, like that poor vulvar conformation, is identified and fixed with the Caslix. They can go on to have healthy foals later.
That's encouraging. So prevention then, what's key there?
Prevention really is the best strategy where possible. A big part of that is a thorough pre-breeding soundness exam for the mare before she even gets pregnant. That includes checking her cervix for competency, ideally when she's in the diestrous phase of her cycle when it should be tightly closed, assessing her vulvar conformation, and then just meticulous hygiene, proper cleaning and preparation of both the mare and the stallion before breeding, and maintaining a really clean environment, clean stalls, good management for the pregnant mare throughout gestation. Minimizing bacterial exposure is key.
Makes sense. Basic, but crucial.
Absolutely. But even with the best prevention, complications can still happen. Abortion, a difficult birth, dystocia, or sadly ending up with a sick, weak foal. These are always possibilities, highlighting just how complex and sometimes fragile pregnancy can be.
Right. So wrapping this up, it's clear placentitis is a really significant, complicated issue in horse breeding, a major challenge. But hopefully, diving into the details like this helps everyone appreciate that complexity and also underscores the critical importance of really watching pregnant mares closely and getting vets involved early. I think the biggest takeaway has to be that vigilance, especially for mares maybe known to be at risk. Catching those early signs like the premature udder development and calling your vet immediately really can make all the difference. It's the best shot at a good outcome for both the mare and her foal.
Exactly. And perhaps a final thought to leave folks with. We've talked a lot about the specifics in horses, this delicate balance in the mare's pregnancy, and how veterinary science tries to intervene. But maybe consider this. What broader lessons about maternal fetal health, about resilience during pregnancy lessons that might apply across all mammals, including humans, could we still learn by continuing to study these really specific, fascinating cases of placentitis in horses? There's likely still a lot that can teach us.